You can instantly see, we talked about the venous pooling, right? The dark circles under the eyes. We have the narrow upper jaw, right? It almost makes it look like the front teeth are too big because it's, you see, we call them buccal
It's
corridors. It's a
yeah,
really
it's kind of like
exactly. It's really a fancy way to say that the cheeks, the smile width doesn't fit, the teeth don't fill the smile width. When we go into the mouth in this upper right picture, notice the tongue doesn't have space. It's getting squished. We call it almost kind of spilling out over the chewing surface. Look at the
hmm
wear of these teeth. I'll show you a close up of that in a second. The tori that Dr. Barr mentioned, those are just bony protuberances. They're benign. It's nothing pathological or disease based. It is not abnormal. We call it a variation of normal. That being said, when you're clenching and grinding and putting a lot of extra stress on the bone with those, we call them parafunctional habits, which why do patients clench and grind more when they have a sleep issue? Well, there are a few of reasons, and Dr. Barker speaks to this probably better than me, but my understanding of it from the dental side, number one, when you're not getting that deep restful sleep, you're in sort of a elevated kind of hypersympathetic state where your nervous
hmm
system is very active. And so you tend to move more and you clench more and your jaws move more. The other thing is you're trying to get your jaw in a spot where you can breathe. And a
yeah.
lot of times, these patients, they're bringing their jaw forward. And that's why she has so much wear on her front teeth. But notice on her back teeth, they look, not that flat and worn. Why is that? Well, she's probably bringing that jaw forward every night to essentially try to make room for her tongue to get away from her throat. And I'm going to show you some 3D images that'll make that a little more clear. So when they clench and put all that stress, many people will know that when you stress the muscles, the bone tends to want to grow. So it's why they say, especially in elderly, right? They need to be load bearing. You need to be using some sort of weight because it keeps your bones strong. Well, these patients get these tori. They're oftentimes
hmm
bilateral, or it can be in the roof of your mouth. That then further decreases tongue space. And so now the tongue has less room and it becomes this sort of vicious cycle.